It's a shot in the arm for the children who until now have been at the mercy of one of the greatest killer diseases. A pneumonia vaccine is now available in all 3,200 public health facilities in Kenya for the very first time. For President Mwai Kibaki, though the children cry, he is happy that now they have been spared the risk of ever contracting pneumonia. It's a vaccine-preventable disease that was only second to malaria in causing deaths among children under 5.
Cutting down the morbidity and mortality from pneumonia will save families the emotional and financial stress of having a sick child, the heartache of losing a child in death, and also enable the government to channel the cost of treatment towards productive economic activities.
We will provide this life-saving vaccine free of charge to every child less than 1 year old in all public health facilities.
Kenya becomes the first African country to introduce a pneumonia vaccine in its public health care system. The vaccine has been in existence for a long time, but was unaffordable for the developing nations. African health ministers joined forces to lobby the World Health Organization to direct the Global Alliance for Vaccines and Immunizations to provide the much sought-after vaccine at a lower cost for African countries. Their efforts bore fruit, and the program has now kicked off in Kenya.
This support for Gavi over the next 5 years will allow routine use of pentavalent vaccines across all Gavi-eligible countries, averting 3 million future deaths. More countries will introduce pneumococcal vaccine like Kenya, vaccinating over 110 million children and preventing 700,000 deaths.
Pneumonia is an infection of one or both lungs, which is usually caused by bacteria, viruses or fungi. Mary Koimbori is a happy mother, having witnessed the launch of the vaccine for a disease she had been at a loss for its cause.
Watu wengi huwa wanasema pneumonia huwa inaletwa na baridi, lakini sio baridi. Juu sometimes hata kuna watoto wengine watokagi kwa nyumba na unapata mtoto tu ameaffectiwa na hiyo pneumonia.
It's an airborne disease that could easily be contracted when a person infected with the germs coughs or sneezes. In other cases, pneumonia is caused when bacteria or viruses that are normally present in the mouth, throat or nose inadvertently penetrate the lung.
I am informed that the bacteria that causes pneumonia also causes meningitis, severe ear infection, and bloodstream infections, which may lead to lifelong disability.
Most people who develop pneumonia initially have symptoms of a cold, for example sneezing, sore throat or a cough, which are then followed by a high fever and shaking chills. Sometimes a patient may experience sharp chest pains that worsen when taking deep breath. At times the skin color may change and become dusky or purplish due to lack of oxygen in the blood.
Ugonjwa wa pneumonia ni mbaya sana. Juu saa ile mtoto amekuwa nayo, huwa na converse mara mingi, na tukifika kwa daktari huwa tunarushia daktari watoto juu saa zingine unaona kama ameaga.
Children and babies who develop pneumonia often do not have any specific signs of a chest infection, but develop a fever, appear quite ill and can become sluggish. But sometimes a child's only symptom is rapid breathing.
Pneumonia is not a strange disease to many families. This baby's brother already suffered from it, and with the launch of this vaccine, it's just a matter of time before pneumonia becomes a thing of the past in this country.
With this vaccine, pneumonia could soon be in the category of polio, tetanus and measles, diseases that have now become history in this country. Sylvia Chebet for Sunday Live.